Here we will discuss what is motion sickness and how to manage it, particularly the medication used in its management. So what is motion sickness or ketosis? It is an unpleasant condition characterized by dizziness, nausea, fatigue as well as vomiting. It occurs when persons are subjected to motion or perception of motion. For example, when you travel in car, the inner ear, which is responsible for the body balance, sends signals to the brain that it is moving. However, your eyes, which are fixed on a particular object, let's say your phone, send signals to the brain that it is stationary. The brain treats these contradictory signals both from your ear as well as eyes, as if your body ingested some sort of toxin and made it to hallucinate, that is, not being in motion but still feeling it. The brain thus triggers vomiting to get rid of any toxic substances ingested by your body. Management includes non-drug therapy as well as drug therapy. Non-drug measures include measures such as sitting in front of a car or middle of a boat, looking straight ahead at a horizon or fixed point, avoiding any triggers such as having electronic devices or reading, can significantly decrease motion sickness associated nausea as well as dizziness. Moreover, acupuncture and acupressure reduces nausea associated with motion sickness. Certain wristbands are available which applies pressure on pericardium 6, which is located on the inside of your wrist. Natural products such as ginger increases the gastric emptying by inhibiting cholinergic and serotonergic receptors. Products containing ginger are a natural and effective way to treat nausea and motion sickness. Drug therapy can be broadly classified into anticholinergics as well as antihistamines. Anticholinergic includes scopolamine, which is usually the first choice when it comes to motion sickness. It comes in patches and applied behind the ear. It is slowly absorbed, giving prolonged action. Scopolamine is also known as hyoscine or devil's breath. It is a natural or synthetic tropane alkaloid. If you look at the structure of scopolamine, you could see this particular point. And this is cycloheptane with a nitrogen bridge. And it is called tropane. Scopolamine dose is 0.5 to 1.5 mg topical and it should be applied at least 4 hours before the intended travel time. A new patch is needed after 3 days, that is, it can work for up to 72 hours. Scopolamine can also be used to treat post-operative nausea and vomiting, like in C-section. It should be used the night before surgery and should be removed after 24 hours. Scopolamine is contraindicated in conditions like close-angle glaucoma because it increases the intraocular pressure and makes the condition worse. Similarly, scopolamine belongs to anticholinergic drugs, that's why it causes dry mouth as a side effect. Scopolamine patches contains metal, therefore it interacts with MRI and should be removed before undergoing any MRI or X-ray kind of tests. Antihistamines are another class which is used in management of motion sickness and it blocks the reaction of histamine and decreases the gastric acid secretion as well as vomiting. Dimenhydrinate comes in both injectables and tablets for the management of motion sickness. Its usual dose is 50 to 100 mg every 6 hours and its famous brand is Rimamine. If you look at the structure of dimenhydrinate, there are two molecules. The first one is diphenhydramine, while the second one is 8-chlorotheophylline. Dimenhydrinate antihistaminic as well as motion sickness property is because of diphenhydramine or this particular structure, while 8-chlorotheophylline actually decreases the side effect such as drowsiness which is caused by diphenhydramine. Another agent such as meclizine also belong to antihistamine and it is a first generation antihistamine. Its usual dose is 25 to 50 mg every 24 hours. And if you look at the structure, you can see this particular point which is basically a piperazine ring. That's why meclizine belongs to piperazine class. Both dimenhydrinate and meclizine are OTC drugs and doesn't need any prescription. The major side effects of these drugs include sinus depression, dry mouth, and increase in intraocular pressure. Therefore, not to be used in close-angle glaucoma. Promethazine is another agent and is H1 receptor blocker as well as antidopaminergic. Its structure shows that it is a derivative of phenothiazine. Its usual dose is 25 mg every 12 hours. Besides motion sickness, promethazine can also be used in allergy as well as to induce sedation. Phenergan is the most widely used brand of promethazine. It should be taken it should be taken with caution in children due to risk of respiratory depression. And it is contraindicated in children having less than 2 years of age. In summary, the aim should be the prevention of motion sickness by taking different measures such as non-drug therapy followed by drug therapy or combination of both. The choice of medication when there is a need of medication depends on an individual case, and majority of these medication causes drowsiness and impair judgment. Therefore, people operating heavy machinery like crew members should avoid using it. Generally speaking, scopolamine is widely used due to its prolonged action, that is up to 72 hours. If there is a compliance issue or long journey, then scopolamine is the right choice. However, scopolamine should not be used in children. The sedation and drowsiness associated with scopolamine can be balanced by taking stimulants such as dextroamphetamine. Diamine hydrogenate is another agent. It is safe when it comes to children. However, it should be used in children above 2 years of age. But it requires a repetition of dose, that is, every 4 to 6 hours you need to repeat the dose. Metlazine have longer duration of action and the second dose is needed after 24 hours. However, it is not safe in children. Metlazine is particularly useful if there is a need for the prevention and management of vertigo. Lastly, promethazine is basically a prescription product and is completely contraindicated in children, but helpful in treating nausea, insomnia, as well as motion sickness. Other agents which are widely used in the EU and rest of the world but not marketed in the US is cenarizine. Agents like metoclopramide and ondansetron, which is effective in treating nausea associated with chemotherapy, is not useful in management of motion sickness. Lastly, diazepam, which is benzodiazepine, may be prescribed as a last resort for people with severe motion sickness. If you find this video helpful and useful, kindly subscribe to this channel and stay tuned for more videos. Thank you.